Welcome to the Five Rivers podcast. I'm Dr. Sumeet Arora. I'm a American board certified pediatric endocrinologist. I'm working at a tertiary care center and leading the division in that department of pediatric endocrinology in India. I have a very special guest here today, Amber, and she is an excellent person. She is a fitness expert, a nutrition coach with a 17 years long history of training a lot of people from all age groups from 8 years to 80 years. And I will let Amber introduce herself. She is also a mother of five, and she's currently doing her master's in public health. Welcome, Amber.
Thank you. Thank you for the introduction. Yes, definitely love being in the fitness industry. Like you said, I have started studying my master's in public health. Just want to take it a little bit further with diving into a little bit more behavior changes in people and just understanding a little bit more statistics on certain things in my community.
That's amazing. I would be very interested to know, how did you start your journey with fitness? What is it that
So
motivated you?
fitness, it's so many areas where I can say that that got me started. Um, I can say, well, I've always been active. Always been active. I played basketball. I cheered. Um, then I had my first child and my second child. I think when it was my second child, that's when I found out like I had gestational diabetes. I was on the borderline of it and had to make some changes. But after I had my third child is when I really got the biggest, and it was hard for me to like deal with being this overweight. So once I had my son back in 2011, just was trying to find my way to see, where I wanted to do with my career. I was staying in Japan at the time, and
Hmm.
so, being a stay-at-home mom at that time, it was like, what can I do? And fitness is something that has always been a part of my life. And the other moms used to ask me, what would I do beforehand, and how some way that I lost some weight. So I just got into fitness, and it just pretty much stuck with me. I guess another story is me having such a bad health history in my family made me not want to follow into those same patterns. So that kind of got me going too as well.
That's very inspiring. And I would definitely say that you look fantastic. You don't look
Oh,
like you
thank
are a
you.
mother of five and you've had that long history of, some health issues as well. You look fantastic. Um,
Thank
so,
you. So I do want to clarify, I gave birth to three and I have a bonus of two kids. So I got remarried. So that's where the five comes in at.
well, whatever. I mean, it's
Yeah.
like he is also like some hard work that you've done there.
Yeah.
Yes, yes. Okay, great, great. Okay. Okay. So, Amber, you did mention something about your family history. Could you just elaborate that, and probably for our listeners and for me to understand, like, if you can tell us and expand a little more about your family?
Yes. So being African American, um, my family in particular, as well as I found out as other friends, their family, we deal with high blood pressure, diabetes, high cholesterol, and then of course, that leads to other chronic illnesses. So pretty big on the diabetes and high blood pressure.
Hmm. So, when you say family, would you want to expand on like how many members in the family and how many of them are like close relatives or close family members that have that?
So far as I can remember, I know that my grandmother dealt with diabetes, high blood pressure, and high cholesterol.
Hmm.
And that's mostly on my dad's side of the family. I have a couple of uncles that deal with diabetes, just being overweight.
Hmm.
So it's my uncles. I have like four of them,
Hmm.
a couple of cousins, aunties, and it's mainly on my father's side that has these chronic illnesses.
Right. So that's quite a significant family history. And then, that's what is known also, like in terms of African Americans being at a very high risk of developing type 2 diabetes and, heart diseases, high blood pressure. And, whatever the literature says, it's like a 60% increased risk of all these conditions. So maybe we could dive deep into, like, what are the factors that go into putting African Americans at a higher risk of getting these conditions. There are a lot of large studies that are out there looking at genetics, looking at geographical region where they stay, like the cultural aspect of it, the socioeconomic status of it, and so maybe we could step by step look into like what are the factors that are going into this. Um, so yeah.
So, far as my father's side, that they have been the community is definitely, when we're talking about socioeconomics, is not the best. They didn't have the access to more fresh goods. I do remember like growing up and like we cooked, but it was always heavy foods, fried foods in particular. Like, I hate to say it, but it is, fried chicken. We
Hmm.
always had either fried pork chops was a big staple too, which
Hmm.
is, of course, not the best source of protein. And then even when we cook like our collard greens, they will cook it in ham hocks, instead of something a little bit more healthier.
Hmm.
And then stuff like the restaurants around in the neighborhood, it was just all catered to like fast food restaurants. It wasn't anything that will give us a better food option.
Hmm. Yeah, I completely agree with that. Like being an Indian, as Indians, we are also at a higher risk. We're actually considered, the thin fat risk factor that we have. From an African American standpoint, that now that you're mentioning the socioeconomic aspect of it, there are a lot of factors that go into this, like the availability of the food that is out there, which is financially sustainable for a lot of people, is mostly those McDonald's, KFC, and all these, like burgers, pizzas. And so
Yeah.
it's they're much more cheaper than vegetables, they're much more cheaper than fruits that we go out there and buy from grocery stores. So that plays a very, very big role into like what we're eating, and what we're getting from outside is just all these high fat, high trans fat rich, high salt intake type of foods, and that is definitely putting us at a higher risk of diabetes and high blood pressure, like you mentioned. But how about the other aspects? So if you're cooking at home, if financial issues are not a concern, what do you think would go into the cultural aspect of cooking that would put someone at risk? When I say someone, like African Americans at risk of getting type 2 diabetes.
Um, Different factors that can play a part into this is the educational.
Hmm.
So not knowing what to cook or how to cook something else a better way is just something that is a missing aspect in the community too. It's like we are culturally like, hey, this is how we prepare this food and there's no other way, or it just doesn't taste right. And
Hmm.
it's the education, it's let's see, some other factors in there. And I just had it was on the tip of my tongue.
So Amber, tell me this, that if with change in the financial stability of a lot of people, how has there been a change in the way that they eat? Is it still the same, or like has there been a shift in the way we're eating now?
So I feel like if there's a change in the financial stability, most people will move into a better neighborhood. When you move into a better neighborhood, you have more access to different resources, better grocery stores, healthier food options to eat as well. So financially, it definitely plays a huge part in being able to change like their diets and how they
Hmm.
cook and prepare their foods for their families.
Right. And so like the way they're eating, is it still the same, like in terms of the what they're cooking at home? Is it still, related to what they were eating in the past, or has there been a change in that as well?
Well, from this is my personal beliefs. I feel like once you come out of a certain environment, you get exposed to different types of healthier options. So instead of like using ham hocks, me personally, I have switched over to using more of like turkey necks to cook with my collard greens. Being exposed to different cultures are is it becomes more accessible to you versus being back into that same community when you don't have the financial stability.
Mm.
More stability in the finances. I feel like the more exposure you get to everything else.
Cool. Um, and that's very good to know because, a lot of times, like, we're stuck in that cultural aspect of it that, it's just the culture, it's just the culture, but also it has to do with, access to a lot of different options. And like you mentioned, like mixing with different cultures and getting the option of eating other food items as well. So great. Okay, so Amber, like you mentioned that, poor resources or lack of resources does limit our ability to buy foods that are healthier. So what are the other options that we can go for? Like instead of eating a McDonald, what is something that you would suggest, which would be much healthier, even in those limited resources?
So in those limited resources, me personally, I know I used to stay in a community where I didn't have these vast various resources. So personally, I made it a way to go out to these stores that are more healthier and obtain like healthier ingredients. But if I couldn't, I would definitely use my phone and like Google like what are the different options. So I would say my kids, they did crave, like they wanted a McDonald's fish sandwich. So
Hmm.
what did I do? I end up Googling a recipe, like, all right, let's see how can I prepare it because I just know that it's more ingredients and chemicals if we went to McDonald's. So we end up going to the store, buying the cod. Yes, we fried it, but it's a healthier option than going to the McDonald's. So just going in and trying to find a recipe that will, you know, imitate that craving that you have, that would be my biggest recommendation is just trying to make it a little bit healthier or prepare it at home instead of going out and grabbing it.
Thank you, thank you. This is really helpful. Can we have a few more examples? I'm really liking the idea of like talking about like what we can switch. Maybe one or two more
Yeah.
examples. Um,
Let's see, another example. Um, Man, I just really feel like people have to be more health conscious of what they're eating. Um, like in our community, I can't think of anything right now on the top of my head. But
so
as far as
what I used to recommend. So I saw one of my faculty members, what they used to do is like whenever like there was a party and there was like pizza or McDonald's being ordered from outside, what she would do is she would not eat the bread and she would only eat the chicken
mm,
and the lettuce from inside. So you're actually taking
smart.
away 60 gram of carbs, and you're
Yeah,
just eating mostly the chicken and maybe it's
the
still breaded.
vegetable.
It's still breaded when you're talking about the chicken patty, but at least the
Yeah,
bread part is gone and she's eating the lettuce, and sometimes, yeah,
yeah,
maybe there's a salad, she would eat that. So I mean, that's one way, especially if you have diabetes, it really helps by taking away that 60 gram of carbs.
yeah.
um yeah.
I like
um
that. I like that idea.
Yeah, I was actually surprised that, oh, that bread is gone. But then it makes sense. Like if you're trying to manage your weight, I mean, there we probably just have to find out how to not waste the food. But then, yes, like how do we tell them, or maybe like get those, flat breads rather than the bigger, thicker buns of the burger, and then of course the swapping from sugar containing beverages to something else, maybe just plain
Yeah.
water, would be one
Or
thing that.
sparkling flavored water.
Right, yeah, yeah. Great.
Hmm.
These are some great tips that really,
I
really
guess I
work.
have another one. Since you brought it
Okay,
up,
yeah,
I would just say try to make sure I tell my clients to just eat protein. Like
yes.
focus on just eating the meat. Like find the meat first because of course it's going to be more satiating to us and that way you'll get more full and that way you won't crave anything else, but eat the meat first.
Right. And I mean, that's in our terminology, we do call it meal order and sequence. So,
Hmm.
we eat the chicken, eat the meat first. I mean, I prefer to tell all my patients that white meat is something we should go for, or fish, but then eat your fiber and then eat your bread. So that does help with the glucose spikes as well. But yes,
Yeah,
that's a very, very good point and well taken tip, and
yeah.
really helps. Yes, yes.
Mm.
So Amber, let's just talk a little bit about how stress plays a bigger part in African Americans in the contribution towards diabetes.
Yeah, so stress is a big thing. Stress, we all stress. So if somebody tells me that they're not stressing, they pretty much are lying. So, when it comes to stress in African Americans, those who are not financially stable or in an underserved community, we're dealing with the stress of making sure that our bills are getting paid, making sure that the kids are in school, food on the table. Um, it's just a plethora of things that we are, dealing with. You even dealing with maybe single parents, in the household trying to manage both roles of a parent. Um, and then that just spills over to work and then in the health.
Yeah, those are some very big factors that you mentioned. Those are like survival factors. And of
Hmm.
course, that, does play a big role in stress. And stress does spill over into management of diabetes. And it becomes very challenging when the degree of stress is so high, it will affect the glucose levels. So tell me a little bit about tips onto how you would, even in these difficult to manage situations, how would you cope up, and how would your suggestions would be to, like, help with that.
Yeah, so coming from a fitness background and my clients are stressed, I will always try to tell them at least go out and get some fresh air. Just take like a 5 or 10 minute walk to at least decompress and just get the central nervous system back down to relaxing. If that isn't possible, even try to just take a few minutes and just breathe. Breathing is very meditative and can again calm down the central nervous system. And I always say, hey, at least try to see if we can pick up some weights because lifting weights definitely was therapeutic for me when I was stressful at one point of my life.
Hmm. So that's a very important factor. So I think, like, not only the factors that you're talking about in the scientific world itself, when we go out, that action itself, going out in fresh air, um, does help to calm the mind significantly. And when you talk about breathing, when we are saying breathe, sometimes we don't realize how passively we're doing it, and we're
Hmm.
realizing we're doing it in a much faster rhythm. When we slow down that breath and consciously breathe, it does activate the parasympathetic nervous system, and it does help to release the nerves, and has a very calming effect on the mind, and does help with the glucose levels tremendously. So yes, Amber, those seem to be very simple tips, but they're, the most effective
Yeah.
tips in managing diabetes. Yes, and managing an overall stress management, they work well. um, let's talk about sleep a little bit. So,
Okay.
there are a lot of factors in sleep itself: the quality of sleep, the duration of
Hmm.
sleep, and how restful we are when we're sleeping. So those factors, if you can touch upon, and how the community itself is affected by it.
Sleep. Oof. Again, parents are, stressed, then you might have to put down the kids. So sleep is definitely a big thing as in the fitness is recovery. Like the recovery part is important because I've noticed that when my clients don't get enough sleep, cravings start to happen. Hormones start to get out of whack, as you probably know a little bit more into detail. But the lack of sleep then bleeds over to the next day and creates more stress, and it's just like a never-ending cycle. So I would try to at least tell my clients to like find a routine. If you can't find a routine, find something that you'll do every night. Like for me personally, I like to have a nice cup of hot tea before I go to bed, just so it can just soothe and calm me down. And then in those days that I can't get to my tea, or if it's not working, I like to take some magnesium to at least
Hmm.
calm my nerves down.
Wow. Yeah, and then you are doing fitness. I think exercise itself is a very big factor that helps regulate the sleep rhythm itself. So when you're exhausted, your muscles are exhausted, you tend to sleep sooner and faster, and you don't. It does help with stress, and so the sleep onset is actually quicker. So I think your role is a very big role in sleep management as well. So yeah, and then a lot of people also suffer from what's called sleep apnea. So
Yeah.
the fat around the neck, it actually leads to obstruction of the airway when people are going into deep sleep. So they're not able to get into deep sleep, and as soon as they do, the because of the obstructed airway, they sleep breaks. They gasp for air and they wake up, and then they start to go back into the sleep. So all night these pauses happen, and then they ultimately affect the overall sleep quality. Daytime sleepiness increases, and the concentration during the day is also affected. So once the weight is lost and once the fat around the neck is reduced, this sleep apnea symptoms reduce tremendously. So it's
Mm.
very important that people who are experiencing that get themselves tested for it, because yes, weight loss helps, but then if they are having severe sleep apnea, then they may require certain technology, like BiPAP machines, to keep the airway open so that the sleep quality is improved, and ultimately that also helps with diabetes management. um,
Yeah, this is good because I tell my clients like, "Oh, how did you sleep today? Like, how was your recovery? Or, sleep, how much did you sleep?" And they'll tell me like 6 to 8 hours. And with you saying the deep sleep is important, I don't think that most people understand like it's not how much, it's the quality of sleep that you get, which is important. And that's when the recovery process really starts to take place in the
right,
body.
absolutely. Amber, we did talk about the cultural aspect of it. So let's dive deep into the doctor patient relationship, of how the community feels and the access to doctors. Is it limited, or what are your thoughts on that?
I think there's a big barrier between African Americans and the healthcare system. We have been tested for different types of diseases. There have been, like, for my grandmother's generation, like, they don't go to the doctors because sometimes they believe that once you go into the hospital, you won't come out. So now going to the doctor is like, all right, if I have something, then I have it. Let everything naturally just take place. If it's my time to go, it's my time to go. And that's really with the older generation. And they may have some issues with the doctors too being a little bit younger than them. So there's different barriers that play a big part of us going to see the doctor and getting checked out for these chronic illnesses.
What do you think would be something that could break that barrier? Anything um, for our listeners that you would suggest that that is going to break that ice into, like, overcoming the thoughts that okay, you need to get tested, we need to get that screening done, so that we're timely detecting that okay, maybe we have a situation where we're just pre-diabetes and we can do something about it. So what is it that you would suggest that yes, let's break the ice, let's take that one step forward?
I feel like when we see more people that looks like us, far as African
Mhm.
Americans, if we see more health providers that look like us and they can educate us, then we have a more of an opening listening ear and to say, hey, okay, maybe I do need to go to the doctor. And even if they have like some health fairs to go into the community, and also with
Mhm.
the people that look like us, to educate us a little bit more, then I feel like that would be a big opening, like the door for us to, or initiative for us to go in and see the doctors and get these type of checkups that we need.
Would you suggest that, okay, more people talking about it, more African Americans talking to different people about it, say for example you're here in this podcast talking about it, will that also play some role in, the acceptance of, yes, there are
Uh,
people who are there to help and,
Yeah, I
do
think so.
something.
Even if it's just like planting the seed, I think
Mhm.
it's a good thing. Just to do. Like the seed may not flourish, but if I plant the seed, somebody else can come in and water it, and somebody else can come in and give it a little sunlight, and then eventually they'll come up and sprout and like, hey, I need to go to the doctor.
Yeah, so nicely put. So because we know that if we have a higher risk, and then we take just one step forward to, get screened in terms of getting just the HbA1c done timely. Sometimes, with a higher weight, with a higher BMI, getting an HbA1c done on time and getting detected with prediabetes and taking those first few steps that are needed to go back to your normal state will really go a long way and in preventing the onset of diabetes. And we probably can catch that much earlier, because once diabetes sets in, there's also this data that, once African American gets diabetes or pre-diabetes, it starts to worsen very rapidly. So then, that part where we can, stop it at an early age will really help, the later progression of it as well. So that's a very important point, that, we just need to water, we just need to plant the seed and keep
Yeah.
watering it, and hopefully things will move in the right direction.
Another thing too with the African American community is that we operate off of fear sometimes. Like, oh, this is this. Well, I need to go get checked out. So, like,
Hmm.
I have a question. So, is there anything in particular, like I've heard and read about, like if the back of your neck or anything and it starts to get dark, is that a good sign for you to go and get screened for diabetes?
Yes, I'm so glad that you brought that up. So yes, this is the darkening of the neck that is there around the darkening of the skin around the neck is the first one of the first signs of developing pre-diabetes. So what this is it's the fancy word of it is acanthosis nigricans, which basically means that this is a sign of insulin resistance. The insulin in our body is not able to work properly anymore. So that's, yes, one of the red flags or one of the first signs that, yes, now we should go more quickly than before to get yourself tested, and, to make those changes that are very necessary to, act at an early age. Also, another one is, the fat accumulation around the belly. So
Okay.
higher waist circumference or higher waist to hip ratio is also another risk factor to developing prediabetes or diabetes later on in life.
So, is it like the tire or is it just like a bloating?
It's both. So
Both. Okay.
basically,
Okay.
so the waist circumference is high.
Hmm.
Yes. Yeah.
Okay. Okay. Is there anything else that we should start looking out that's physically
So
that we can?
So there are a lot of non-modifiable risk factors. So one is like we already are talking about ethnicity. So African Americans, Hispanics, Indians, we're all at higher risk of getting type 2 diabetes. Then we're talking about people who are born underweight, kids who are born underweight. Later on, they end up developing type 2 diabetes because, they're evolutionary, or like during their fetal development, they were born to be small, but then if they had a very fast catch up after being born, their risk of
Mhm.
developing type 2 diabetes increases significantly. So that's number two. So people who have gestational diabetes, they uh, are putting, or let me rephrase this, kids who are born to mothers who had gestational diabetes are at
Mm,
a high risk of developing type 2 diabetes as well. So
okay.
those are some non-modifiable risks. But again, the diet and lifestyle, the more processed foods that we're eating, the more sugar-containing beverages that we're drinking. Again, those insulin spikes are so much, and that is leading to a lot of fat gain because of those insulin spikes. So then that risk is tremendous compared to like if you're not eating or drinking these kind of sugar containing beverages. So there is obesity, which is metabolically healthy, versus
Hmm.
obesity, which is metabolically unhealthy, which means you are overweight, but you're not that much at risk of getting, all these complications of diabetes, high blood pressure, heart attack. But when you're metabolically unhealthy, this is going to happen soon, or it's already happened. So people, yes, with the darkened skin around the neck, the high waist circumference, those people are at a higher risk of being metabolically unhealthy.
So it's safe to say that all of this can start from the mother and what
Yes.
she's ingesting. So it starts pre-birth.
Yes, yes. So there is much now that we know in terms of genetics and epigenetics. So genes are something that are there in the fetus, but what is the environment of the fetus is also
Mm.
programming them to what's going to happen in the future.
That's interesting. The environment within, and then once you come out, then still it's the environment.
Yes,
That's a lot.
yes,
That's a
yes.
lot. I did see with me studying with the masters in public health, like we're in a this is dear to my heart, like the childhood obesity epidemic that we're dealing with. I
Mhm.
can't remember the numbers exactly, but there will be a high increase of diabetes in kids from 12 to 19. And my hope is like, how can we like reverse this, or how can we, get ahead of this with the kids?
Yeah, I'm glad that you brought that up. I'm a pediatric endocrinologist, so I
Mm,
see this day in, day out. When I was at SUNY State University of New York, that's where I did my fellowship. There were a lot of African American kids who would come in
mm,
with type 2 diabetes. So, usually when in the past when we would talk about diabetes in kids, it was mostly in reference to type 1 diabetes. But now
mm-hmm.
type 2 diabetes is much more rampant in this age category as well. So, what has changed is, yes, that gestational diabetes, again, that's a non-modifiable risk factors. We're also seeing a lot of kids who are born underweight and then they suddenly catch up. Again, that's a non or somewhat modifiable risk factor, but also the degree of exposure of these processed foods, the salt, high fat, high sugar foods that they're
Hmm.
exposed from right from childhood. So if we were to take a decade ago or like 50 years ago, the tendency towards eating outside food was not that much, even though it may not be that healthy, but then we were not eating that amount of high salt, high sugar, high fat foods that we're eating now. The tendency towards eating high amount of sugar containing beverages is so much. Day in, day out, everybody's eating, drinking a lot of sodas. So that is putting all the teenage population or even adults at a very high risk of type
Yeah.
2 diabetes. Yeah.
I feel like I consumed a lot of sugar as a kid, but I think I was a lot more active
Hmm.
as a child.
Yeah, and so it did play some role, if I'm allowed to say that, Amber, because
Hmm.
because that's probably also one reason you might have developed gestational diabetes, because you became metabolically unhealthy. But then it came into picture only during pregnancy, is because pregnancy hormones, they tend to have an insulin resistance effect. So when your
Mm,
body was under that pressure and insulin resistance increased, that's when it came into picture. But before that, because you were active, we didn't see that happen.
Mm.
But thankfully now that you're in fitness and now things have changed and you're metabolically healthy, you're
Yeah.
able to take care of it in a much
Yeah.
better fashion. So that does play a big role. I have seen a lot of people who have been overweight all their life, and I'm not saying that it's good or a bad thing to do that, but because they are overall eating a well balanced meal, but because of some reason in their lifetime they may have eaten a little higher portions than their activity, they became overweight. But then because their eating habits are still okay, they are still metabolically healthy and they have not developed diabetes, versus
Mm.
people who, even with a lesser weight, lesser BMI, not that degree of obesity, just being overweight, tend to develop diabetes very quickly because of the environment that they have created and because of their lifestyle and day-to-day diet that they're taking.
I've definitely been reading a little bit more about, like, when you say metabolically, like, not on a good route. In my head, I'm thinking lack of muscle. Is that a good way to think about it?
So there's more to that. So yes, lack of muscle, because muscles do play a big role in insulin sensitivity,
Mm-hmm.
but also how much fat is deposited around the organs. So if
Mm-hmm.
there is a lot of, we call it visceral adipose tissue, which means that the inner organs have a lot of fat around it, there is a much higher risk of developing insulin resistance, which means that your pancreas, whatever insulin it's producing, it's not able to work properly, and it is ending up having to produce a lot, and ultimately at some point in time it'll get tired and then we'll develop type 2 diabetes.
And it doesn't necessarily, like, I tell my daughter, she's small, like one of my kids, well, I have two of them, they're small. And I was like,
Mhm.
oh, I'm not, I'm fine. I'm like, no, you're skinny fat. Like, just because you are not obese, you still need to worry about your health, because I feel like they have more fat on them, even though they may be small and tiny, because
Mhm.
they don't have enough muscle on them to help with this insulin regulation of their bodies.
Very true, very true. And that bang on. And that's what I, a lot of times I tell my patients as well that, you really need to work on that muscle, because once you develop that muscle, the insulin sensitivity will increase. And yes, you are going to be in a better shape, in a better metabolically healthier condition. Uh, Even though there is still a little bit of waist circumference fat, but at least that muscle part is preventing that from happening, preventing the adverse effects of it from happening, and maybe delaying it, if not preventing it
Hmm.
completely. Yes, very good point. Yeah. So, Amber, it has been lovely chatting with you and talking to you and knowing you. I'm so happy that you've been here and giving us your insights about all this. And it's such a wonderful information that we have now. And but I would want to leave our listeners with some positive note and your key take points, and would want to hear from you.
Okay. So what I've gotten from today, three key points that would help us as African Americans. Number one, I would say go get screening. So if you have, like Dr. Sumeet said, like the darkening of the neck, the waist circumference is pretty big. And if it was one more that you had just said, with the circumference, the neck, was that it?
And the diet.
Oh, and family
Yes, family
history.
history, the diet.
Yeah.
Yes.
Yeah, and if you have family history, you need to get checked out. Number two, I would say that the food. So let's try to find different ways to, change some ingredients in our food prep. Look up recipes, healthier recipes, and try to at least add a little bit more. Like I tell my clients, food, eat the rainbow. So that's with the food. And number three, my last one, for me personally, when I tell all my clients, and as Dr. Sameet has, you know, uh, confided in me or agrees with me, that taking some steps, I would say at least take, if you don't have anything to count your steps, at least take like 2 to 20, 30-minute walks a day. If you can't do that, at least just get outside every day and start taking some steps. And that way it will combat some sleep, it will combat stress, and then that way you get your physical activity. So those are my big three takeaways.
Such good points. I think those are the most important points that you brought up. And the last one is, very special because exercise, movement, all this is a big one that helps with insulin sensitivity. And yes, and hoping that, these 3 points could be implemented right away. It doesn't take much to just
Yeah.
start it today. So thank you, Amber, for being here, and it was wonderful,
Thank you for
wonderful
having me.
chat. Yes. Yeah. Thank
Same.
you.
Thanks.